Our next presentation will be offered by two co-presenters. First, Dr. Kathryn Cheek. Okay. Thank you. Dr. Kathryn Cheek, who has worked in private practice since 1986 as a pediatrician in Columbus, Georgia at Rivertown Pediatrics. She also has served as a pediatric faculty member with the Medical Center of Columbus, Georgia, clinical associate professor in pediatrics at Medical College of Georgia in Augusta, as well as clinical assistant professor in pediatrics here at Mercer University School of Medicine. And Dr. Cheek serves on boards of the American Board of Pediatrics, a fellow for the American Academy of Pediatrics, voluntary recertification with the American Board of Pediatrics, and also maintenance of certification with the American Board of Pediatrics. She completed her Doctor of Medicine degree at Medical College of Georgia, completed her Master's of Health Education at Medical College of Georgia, and then also her Bachelor's of Science at the University of North Carolina. Our second speaker is Dr. Denise Hines. Dr. Denise Hines is an award-winning, nationally recognized expert in healthcare technology. She has more than 2 decades of healthcare experience in a variety of settings, including health systems, physician offices, home health, technology vendors, consulting, state government, and revenue management. As the Chief Americas Officer for FHIMSS from January 2019 to July 2021, she had direct oversight over a business unit responsible for generating annual revenue in excess of $50 million through professional development, member services, conferences, and events. She also served as executive director for the FHIMSS Foundation and led initiatives on women in HIT and global health equity. Since its founding in 2013, Dr. Hines has served as executive director of the Georgia Health Information Network, which is the state-designated health information exchange. Her firm, eHealth Services Group, is contracted by GaHIN, which is the Georgia Health Information Network, to provide the staffing needed to support the nonprofit's mission and activities. Dr. Hines has been instrumental in advancing healthcare connectivity in Georgia, ensuring physicians have the information they need to deliver quality care. Through her work at the local, state, and regional level, Dr. Hines has improved technology adoption and advanced exchange. In 2017, she was recognized with the prestigious Women of the Year in Technology Small Enterprise Award from Georgia's Women in Technology. Ladies and gentlemen, Dr. Kathryn Cheek and Dr. Denise Hines.
Okay, thank you so much. First of all, this is the first time I'm Dr. Cheek. First time I've been to Mercer, to this campus, and to see your beautiful facility. So I'm so appreciative to be surrounded by all these beautiful pen leaves. I really feel very lucky to be here today. Just want to tell you, though, that I'm sort of the teaser. I know you've all been to concerts before, and they kind of have the little, the person that's up front that's just playing the guitar on the stage, and then the big band comes. So I'm just here to just give you a little bit of tease about technology and how technology can help your practice and, make things better in your life easier. So really, life just got easier. Do want to say that I have nothing to disclose, and the applications and the apps are freely out there on the internet, but I don't endorse them. I'm not selling their products or telling you for sure, just like you check out any other app. If you choose to download any of the things I'm suggesting, I suggest you take a real good look at it. So with that, we'll get started. And first of all, let's see. Oh, I went backwards. There we go. We have some objectives. I'm going to show you the beginnings of ChatGPT, how it got started. I'm going to talk about some of the possibilities in medicine and demonstrate some apps that really may help you in your day-to-day work. So first of all, I got to keep going in the right direction. Okay. Does anybody here use ChatGPT? Have you ever used it? Raise your hands. A few. So good news, artificial intelligence is here to stay. You will be using it if you're not using it already. Definitely within the next year or two, probably after you see this talk, maybe within the next day or two. It basically started in the 50s, and Mr. Turing said, once a machine gets to the place that it can have a conversation like you and I, then it's an intelligent machine. And you see how things have transitioned through the years. Things went sort of slow. They did all kinds of improvements. Really, the most exciting thing has occurred since the 2018, 2019. We're talking about just a few years ago. And basically, GPT number 1 came out, and then 2, 3, 4 more editions. It continues to fine tune, and you'll hear about artificial intelligence. You'll hear and read in the papers all kinds of concerns about social and ethical problems that can be associated with this, misinformation. OpenAI is the company that makes ChatGPT, and really it has transformed the way lots of information is documented and exchanged, and things are created. It's exciting, it's unbelievable, and once you see it in use, you will just go, wow. But we will all need to make sure that it is used professionally and, ethically going forward. How can we use it, and how is it being used already today? And how can it make your life easier? Medical information retrieval, clinical documentations. I don't know if you have to document in your office, but they're already coming out with projects that can document the whole conversation, everything that's going on in your office, and they summarize it as a SOAP note, and it pops in your computer. Patient education. You can print all kinds of information in just a second about whatever you want to give education on. You can have a symptom checker and, triage, and tells you the kid shows up with a purple rash or a red rash that's on his face. It'll give you all kinds of opportunities to look through. And if you're in a hospitalist, it gives you all kinds of algorithms of where to start your treatment. So that's out there. It's certainly going to be used in medical training. The machine will ask the medical student questions and generate possibilities for them and to get them to interact. You don't even have to have a fake patient. It's just right there in front of you with just a computer. Telemedicine support. So if you've never tried it, don't miss out. The first ChatGPT is out there on the App Store. It's free. The free version, you have to know that the information stops in 2021. So, if something happened after that, say who won the World Series last year, it's not going to know that. There is a paid version where you can get that much information, but the free version is kind of interesting. If you want to know who was the first pediatrician in the world, something like that, or if you want to know anything more technical than that, you can ask all that. So anyway, don't miss out. ChatGPT, you just download it, okay? I want to mention Doximity. Has anybody ever used that? Know what that is? I don't know how you use it. Some people, just see it to view their colleagues. Some people use it to get medical information about news that's going. Myself, I use it to call patients because you can call the patients. It doesn't reveal your phone number. It allows you to send them a text if they don't answer. And then if you've had a discussion with them, it allows me to text them and say, I've sent your medication over, or here's the information that I wanted to give you on roseola, and it pops up on their messages. That's the way I use it the most, but it is most recently added a Docs GPT component. And if you'll see right on, I don't have a pointer, but you'll see right across the top, it says Docs GPT. And so this can be very helpful to you. And I'm going to show you some ways. Examples say, if I need to write a letter to get Social Security benefits, I can do that and help support that for my patient. If I wanted to go ahead and write asthma care instructions for my 8-year-old patient in the method of Dr. Seuss, I can make that happen. If I want to write a letter to Cigna to say, why in the world did you not agree to getting this patient this treatment, I can do that, okay? It is a HIPAA compliant app. In other words, everything is definitely, when you transmit back and forth to your patient, is HIPAA compliant. They have actually where you can do a video phone call, and so you don't have to have a special app to do a video teleconference with your patient. You can switch right over from just a phone conversation to a video conversation. That's really nice. It's all trained in medical technology and terminology and abbreviations. So when I say CBC, it knows what I'm talking about. And it makes it easier, and it's fluent in dozens of languages. So if I've got a Spanish speaking patient and I need to tell them, okay, I'm going to give you the handout on measles or roseola, but translate it into Spanish, it does it like that. Okay, occasionally it does generate wrong information, and that's what I'm talking about. You want to make sure that you read, just like anything else, what you're getting ready to send to the patient. It's taking information from databases. I think it said 175 billion sources, and I'm sure it's more than that now. That was probably last week. There is wrong information in there, but there is a lot of right information in there. And so you need to look at it closely. And of course, on the free one, it stops at 2021. So here's just an example of the Dr. Seuss letter. I hope you can read it. In a house with a mouse under a tree. If you have asthma, your specialty will see. But don't you worry, don't you fret. We have some tips you won't forget. And it tells you how to take your inhaler and your control of medicine and all that. And the messages of Dr. Seuss, which is fascinating. Okay. So, I want to, let's see here. I'm going to get my assistant to come help me, because I want to just let you see it in live and work and just see how fast this happens. We hope this is going to work and how technology. If it doesn't, I have a backup plan.
Oh, good.
And this is my profile on Doximity. And remember, I have no allegiance to Doximity. I just use it. It's been helpful in my practice.
So then we had typed in something.
Where is it? Oh, here.
We can see if there's anything else open. Yep.
Right there.
Okay. You're going to have to type it.
Okay.
Okay. So normally in my practice, I'm getting her to type this because this.
Oh, I need your
Oh yeah. This computer doesn't have the voice activation. I use voice all the time and dictate. I'm sure probably many of you do too, to talk to my computer and get to do whatever. But this computer didn't have that. So normally I would just sit there. I would click on the Docs GPT, and then it says Kathryn, and it's got a little microphone, and I say whatever question I'm going to say. And she's putting that question in right now. So I'm telling you what I would normally, this is how I did it last night. I wrote this. I said, write a letter to Blue Cross Blue Shield of Georgia requesting reconsideration of a denial for my patient, Alex Cox. She's 2 years old, and since she's only 2 years old, she needs a CT of the head, not an MRI of the head, because we really don't need all that sedation that it would require to get her the MRI. I really can get the information I need just from the CT. So I've asked Blue Cross for Docs GPT to write me a letter to Blue Cross Blue Shield to get this. Okay, and normally I said I would, and so.
Okay, now, hold on one sec.
You got to.
Now we're going to put that over here.
It's writing the letter right now, and he's got to get this to go up there. Watch this.
Yeah. Thank you. Yeah, so we just typed it in, right? And then you hit
just type in what I said. Normally I dictate it.
enter, and then
And enter, and here's what's coming out.
who knew?
Wow. So I want you to see it live and in person. So that's the teaser. Like I said, I'm the teaser. If you have more questions about any of this, you can ask me later. But go back to my presentation. We are now on to real technology in Georgia, something that's really happening. And let me say about my friend, Dr. Denise Hines, that's coming up here. We've worked together on lots of projects. I use GaHIN, not every day in my practice, but I have a lot of foster care patients, and I've been passionate about trying to get the information that I need from them. And I've worked with her and GaHIN and had some very positive examples of things that GaHIN has made a real difference in being able to locate information on these patients. So that's my beginning. Like I said, I'm the teaser. This is the real deal that you came to listen to today. Okay?
Thank you, Dr. Cheek. And I can tell you Dr. Cheek is the strongest advocate I know of ever in my experience in healthcare. She is advocating with every commissioner, every partner, everyone that is interested in learning more about how to improve healthcare for children. So we meet every month at 7:30 a.m. And we are there talking about technology and working together to improve healthcare for children. So thank you for having me. I did graduate from Mercer University in Atlanta with my master's degree in the late 90s. So I won't count this out there. So as Dr. Cheek mentioned, the Georgia Health Information Exchange is your Georgia Health Information Exchange. It is the statewide health information exchange network for our state. It is state designated by the governor's office and funded specifically through the Georgia Department of Community Health, among other agencies, as well as federal grants through the Office of the National Coordinator. And we most recently received $1 million from the USDA to help improve connectivity in rural areas. So we're working with several of our community-based organizations in rural areas. So to give you a sense of what we do, we are here to connect all related stakeholders in healthcare. We started with a group of people who had a vested interest in making sure that everyone at a table who is interested in taking care of a patient could see the same information, could have health information at their fingertips in order to provide care. So our goal is to provide health information to providers and stakeholders across the entire state. So this model tells you, or what you can see, state agencies, we have ambulances, payers, public health, health systems. In the purple, we have providers. We're connected to the national network. If you're not familiar, we've been building a national network that says if Denise Hines moves from Georgia and I move to Florida or Alabama, North Carolina, my health information should follow me wherever I go. So Georgia's information exchange is connected to the national network so that health information can follow that patient everywhere they go. So you are fortunate to live in a state where your health information exchange network is an award-winning network. We've been up and running for over 10 years, and we have documented achievements. We've exchanged over 20 million continuity of care documents, care records, medical records, PDF forms of care throughout our state and our providers and the national network. We also exchange securely messages for providers who do not have ways to submit through an electronic health record. We give them technology to securely attach documents and exchange information that way. Now you can see we've grown dramatically over the last couple of years because just in 1 year, we've exchanged nearly 20 million just this year. And I'm going to talk about the dramatic growth we've had just in the last year. And then we average around 1.2 million messages among providers every year. And these tools that I'm describing today are available to Georgia providers at no charge from GaHIN. And I have to put that disclaimer because sometimes technology vendors will charge for interfaces, user licenses, but GaHIN does not charge our healthcare providers. So let me talk a little bit about how many people we have connected and what we connect to. Hopefully you'll see some of the nationally recognized hospitals. CHOA is definitely on there. Piedmont, Northside. So the facilities that you're familiar with should be up here on the screen. I want to talk a little bit about the state agencies because we have really taken a tremendous amount of resources and time to connect the state agencies. So if you query our state health information exchange network, you're going to get information from DCH, claims data. you're going to get information from public health immunization data. More importantly, in the work we're doing with Dr. Cheek is we've connected DFACS. DFACS needs to see information, health information on the children in their care. We also provide them with alerts. So if one of the children in their care presents to a hospital, we send them an alert. So a child has presented to Children's Healthcare of Atlanta. An alert goes back to DFACS to say, hey, one of your kids just presented in the hospital. Get on the phone, send an alert or call, or they can query and take a look at that record and make sure that they understand what's going on. We've been talking about behavioral health. We've taken the time to meet with several attorneys to work through the HIPAA requirements about connecting and sending health information. We have the inpatient facilities from the state agency from Behavioral Health connected. So if there are double consented, because that's the rule with behavioral health, there's double consented health information available to us, we're going to send it. Double consented means that the patient in this instance with behavioral health has to consent to send it to our network. In other cases, everyone's in unless they say, take me out. Behavioral health right now with all the laws say we have to get consent to put them in first. We're working, and this is something Dr. Cheek and I and PHIC are advocating for. Can we do something around those behavioral health rules to help us and providers receive behavioral health information at their fingertips when needed? So that's something Dr. Cheek is helping us advocate for. We also have rural hospitals, and we also have correctional facilities, federally qualified health centers, and CMOs. If you're a pediatrician in Georgia, you're probably going to encounter one of the care management organizations through DCH. They have the ability to work with you through GaHIN to see immunization information, along with working to see provide claims information, along with receiving a service that tells them that members have moved from plan to plan. So we provide them with that tool as well. And then our rural hospitals and critical access hospitals. So I mentioned we are connected to the national network. And again, that provides us the ability to communicate with other statewide exchanges or other organizations on the national network. So if I leave Georgia and go to North Carolina, my health information can be there. We also communicate with nationally recognized providers who may not, who have a presence here in Georgia, but also a national presence. So your CVS's or your Kaisers, your Walgreens coming on. So we are looking to make sure that anyone who has presence in Georgia, healthcare presence, can get health information. We also are connected to the federal exchange, so the VA, Veterans Hospitals, Department of Defense. They have information in the network and partnered with Wellstar and Grady and Emory. Their health information is in the network and available to providers. So let me talk a little bit about services, because it's not just about moving documents. We also do, again, I mentioned we're on the national network. Now, I can say that we also participate in creating standards, because one document is not one document that is equal. We have to work with these federal committees to make sure that we can get discrete data. So if a document or if a data field has name, let's take something very simple, and I'm sure all of you have seen this. Denise Hines could be Denise Hines, Hines. I could be Heinz Ketchup. I could be D. Hines. I could be Dennis Hines. And somewhere along those lines, the matching has to happen. So we work on matching through our master patient index. And the more facilities that are added to these connections, the more likelihood or more complex a matching it becomes required. So we work with Dr. Cheek and other pediatricians to help us with crossover sessions. So let's say, for instance, we have a Denise Hines, and let's say I'm 10 years old. I go from Children's Healthcare of Atlanta to Grady, to Dr. Cheek's office, to get my immunization done, to health department. I could be 5 different names throughout that process. So we work with our pediatricians to help go in and, as they are authorized to do, query to see if they see all of the stop points that I had, so we can confirm that data is correct, matching is happening as it should, and that the pediatrician can see all the authorized documents that they should be able to see. So that's something else we do with Dr. Cheek's assistants. So we meet our providers where they are. So for example, some of our providers still don't have electronic health records. We understand that, and some, for example, long-term care, most are coming on board with technology but may not have it. Ambulances, dentist offices, most are still implementing technology. So what we do is we offer just a basic service. Can you get Wi-Fi? If the answer is yes, we start there. So we offer what we call secure messaging. Looks just like email. They can attach, upload a PDF, Word document, and exchange securely information with their care coordination teams or anyone else that needs to receive that. And we set that up and send and receive millions of messages per year. So these are usually those outliers that have not adopted technology. Then this is where most of you will probably end up seeing data from the exchange, query and retrieve. So if you go in, Children's Healthcare of Atlanta uses the EPIC system. You go in, Denise Hines has presented. Query for Denise Hines. In the background, CHO is connected to GaHIN. CHO is connected to GaHIN, and GaHIN is searching every connection we have, looking for everything we have on Denise Hines. We're going to present that back to CHOA. And CHOA is going to organize it where it's viewable to their users. Dr. Cheek is connected to GaHIN. She has a way to see the information as well. So what we're doing now is, this is a longitudinal record view. We're bringing everything now in discrete data so we can put it in a longitudinal view for you. So you're going to see medications, allergies, problems, alerts if you have them, all in one longitudinal record. And it's going to show you, and you can drill down if you want, or you can sort it the way you want to, the way you use it. But for us, we're going to present this in a longitudinal view. And this is where we're trying to get to in healthcare. If we can get discrete data, match it up, put it in the right fields, we'll be able to put it in this view. And this screen shows that we have continuity of care records available for this person. We have immunization information. We have the 3231 form available. And the provider can pick something. You'll see in the red, it's out of, it has a high glucose report. So the provider is notified there and can drill down into that record if they would like to. They can also trend it. They can also see previous visits, tells you where the visit happened, dates, anything that needs to be flagged. So we put this together for our members. So then we can also provide, again, the graphing of labs. We can see growth charts. We can see weight charts available for our members. So this helps our providers who log in to see everything we've gathered. We can chart it and make sure it's available to all of you for use. ADTs work where if you're the provider on record, you want to be notified when one of your patients presents into a hospital. We can also notify on any kind of alert. If it's in the data, we can notify on it. So if you want to be notified that a specific medication has been prescribed to one of your patients, we can send you an alert. If you want to know one of your children has been presented in one of the hospitals, we can send you an alert. From there, you can decide if you want, what the appropriate medical actions are, but we set that up for our users. So patient can be admitted, discharged, or transferred, even held on observation or treated in the ER. And again, if it's in the data, we can alert or let you guys know there's something happening for your patient if that's what you would like to see. So that is the clinical side. I want to talk a little bit about the social care side. Now, in the data, we're going to get Z codes. If you're not familiar with Z codes, those are the codes associated with social determinants of health. We're starting to try and advocate for our healthcare providers to put that in the data. Race is hard to capture. Addresses, all the zip codes. So that social determinant of health data, education, comes in on the clinical side if it's captured by the clinician. So one of my favorite stories that I've learned through our pediatric group is, and Dr. Mann touched on it, the pediatrician serving as the community coordinator. So we're going to talk a little bit about community care and where that data is coming in. So we're hearing that our pediatricians have cross-trained their staff to understand where the community resources are and do screenings. So they're screening on, do you have a home? Do you have a caregiver? Do you want to go to high school? Do you have food to eat? And let's just say some of those answers are no. Our pediatricians are asking their staff to coordinate with the local community food banks, the Walmarts, the pharmacies to get vouchers. And so what happens is that community coordinator, who's also the office manager, is working to get on the phone and make phone calls to those local community-based organizations. So they call, get services, give the mom a voucher, but they never know if the mom goes to get the service. Give the voucher, mom goes home, child comes back a year later. They never know what happens with the mom unless that community care coordinator, which is their office manager, calls back. We have now added a way to capture that workflow. We call it closed loop referral processing. So we call it Georgia Unified. We've added where our pediatricians and users, clinicians, will be able to see clinical record, longitudinal record, claims, immunization, social care, and also any referrals made for that particular patient or child. So the way it works is the user, let's assume it's pediatrician or family medicine, would pick the referral process that they want. So let's say they're going to refer someone to the United Way. Patient sits there, they're in the patient record. They're going to launch out into this part of GaHIN. They're going to pick the service they want. So United Way, connected on the back end, is part of GaHIN, which is what we're working on now. The provider can also add their own screenings if they want to. That screening I just mentioned, they can add that into GaHIN. If the answer is no, or if they want to trigger off of a yes answer, yes, I need services, it's going to trigger out and offer them the listing of available services in their area. So they get the directory, and then they can launch the referral. The tracking of the referral happens, and then the loop opens, meaning the loop goes over to the United Way. United Way receives it and says, hey, I've gotten something. They now launch into their process within a United Way to receive it, work the referral, and offer the referral back to the patient. Patient comes in person gets the process or the service, United Way closes the loop. Patient showed up, got the service. So the social care provider has received the service, checked the location, did the fulfillment, closes the loop. All of that is now tracked in GaHIN. So what you see with these workflows is how we set up a workflow. So we can call the United Way, we can call a CSB, CBO, community-based organization, and work with them on their workflow. So this works both ways. We can close a loop and or we can set up the process within their office. So if the United Way does not have anything, which we are talking about moving from healthcare providers who have been using EHRs for years to community-based organizations who are using Excel spreadsheets today. Most of them are. Some are now adopting technology. So we can offer them an instance of this. So if that same pediatrician always calls the one location in the United Way, we can go to the United Way and build their workflow to work directly with that pediatrician or others in that community. So this is what we're working on now. So everyone in that loop, from the pediatrician to the mom who can log in, to the United Way, to the office manager, can see what has happened with that patient. And we call that closing the loop for care. So that's what we're looking at for the future. So today we're still mastering or still onboarding healthcare systems, exchanges, agencies, CMOs, Medicaid providers through GAMIS. If you use GAMIS, you should have a launch into GaHIN, which is coming soon. And then future social and community-based organizations. We talked a lot about behavioral health. CSBs there are 22 of them in the state of Georgia. We're in the process of making sure all of them can get to GaHIN because the community-based organizations are now becoming even more important outside of the inpatient processing for healthcare. State social care programs, EMS, home care, all of these are now our new targets for bringing them into healthcare. So all of you will be able to see the longitudinal whole person record. You may be hearing that. We're calling it also the unified record when we bring in that social care referral process. So for you to get involved in GaHIN, we are going to ask you when you call us, or if you say, hey, I've never seen anything, I need help. We're going to ask you what your needs are. We can help you with referrals, the longitudinal record, working with electronic case reporting that goes directly to CDC, immunizations with GRITS, and we also work with our providers on pilot programs. And so next steps, basically, reach out. If you don't have access to GaHIN, let me know. I will make sure my team reaches you. If you're connected to a major health system and you use their electronic systems, you're probably getting information from GaHIN in the background, or usually on another tab that says outside documents. Training, implementation. And so we are here as your statewide health information exchange network to support you. We also are connected to public health. You can submit to the birth defects registry. You get GRITS immunization information. We're connected to the Alzheimer's registries. So if you haven't heard of us, please let me know, and we'll be more than happy to make sure you get connected and or find out if you already are connected. So with that, Dr. Cheek, I'm gonna call her back up, and we can take questions or see what we have. You did good.
Thank you for this. It was really interesting to hear this and to talk about how the data is being collected in the background. My question is, even within our own healthcare system, patients get several charts because they have duplicate last names or things like that. Is there any talk in your world about developing like a nationwide or a universal level M number or ways to try to help with the matching process in the background?
Yeah, I could, from a national level, we have been advocating for a national patient identifier that hasn't gone far. We receive constant pushback on that. But as you can see in the example I gave, every time, like you mentioned, a patient presents, they're going to get a new medical record. So we at GaHIN, we have these algorithms that do the matching. And when we find, and that's why we rely on some of our pediatricians and other providers to confirm that our matching is happening. It's complex algorithms, but we are still advocating for a national provider ID. You can Google that. It's been out there for 10 years and it doesn't get a lot of traction though. But the more organizations we add to the network, the need for you to have information from, let's just say, everyone at your table, it gets complex, and it's going to continue to get even more complex as we add and have the need to see the longitudinal record.
And I'm sure all of you are aware of the complexity of babies. We have so many babies that are born with a mother's name. And then, of course, some mothers have problems, and then DFACS intervenes, and that baby goes into DFACS. And the mother may change the name to another last name, and then it's now moved out of the address that it was at, that it was identified with. And so there's nothing that matches other than the birth date. Mm-hmm. And so, yes, there are complex algorithms and all kinds of systems because that baby got an immunization in the hospital. Mm-hmm. And that was the number one thing. And so I need to know that. But more than that, I also, as now the poor pediatrician that foster care child shows up in the office, I need to know what happened in the hospital. Mm-hmm. And so we have found ways to find it, but it is a challenge. It's a challenge from a public health, immunization. It's just a challenge.
Yeah. We also have, in our new capabilities, we can, for example, with DFACS, not require address if we can get other fields to allow them to search on. We get their roster, but also if, for example, Dr. Cheek is looking for a child who is in the DFACS roster, she's probably not going to have a good address. So we are working with the pediatricians, get that use case to our software developer to say, hey, in some instances, address just can't be a required field. We have to come up with other ways. Now, what Dr. Cheek will get if she does a search on Denise Hines and she doesn't have an address and she has maybe a date of birth, she might get 3 or 4 Denise Hines, and she's going to have to intelligently pick which one because we don't have an address to match on. But that's better than, what we have to work with, 2 years ago.
Yeah.
Oh, sorry.
I'm sure it's already complex enough trying to work within the state of Georgia. Is there any thought to, especially for immunizations, working with other states like Florida or Alabama? We get lots of kids that come from there. Parents don't know a previous address, especially if they're in foster care. Yeah. And we have trouble getting their previous shot records from those states.
So what we're doing is we're locally connected to the immunization registry, GRITS. Not sure who named that, but it's called GRITS. We're locally connected. So your local Georgia base, if it's in the immunization registry, you'll get it. We're also connected to the national network. What that will allow us to do is create a document that will flow, across state borders. We can also pull down if another state has an immunization record that is available, we will pull it down if the name matches. So that's the beauty of being on the national network, because all of us, meaning all the statewide exchanges and those standards on the national network, we all use the same standards. So we should we should be able to pull down documents that go cross borders if it's available. So we constantly advocate for more people in healthcare to be on the networks, because if it's available, we can get it. If they're not on the network, it's not going to be there.
Is ConnectX EHR vendor agnostic, or do you have to have specific EHR vendors in order to be part of ConnectX?
It's vendor agnostic. We all use technology standards in the background to connect. So if you're using a off-the-shelf EHR vendor that's approved, I would say, by the EHR Association or something like that, we can connect through HL7 profiles. We can even take a flat file if we have to. It's not our favorite, but we can. We can.
Has this been implemented with defects yet?
Yes. So what we're doing now, literally right now, today, yesterday, is creating the longitudinal view for DFACS. They want, from pediatricians, they want all well care visits available to them. So for us, meaning GaHIN, we need to get back to our pediatricians. So this is going to be my ask to Dr. Cheek. Can you help me get as many pediatricians contributing the well check visits to GaHIN, because that helps DFACS. So DFACS will have the longitudinal view that I showed. They'll also at some point be interested in using the social care record, because children are referred out for many services. So DFACS will have longitudinal record. They have access to GaHIN now. Their roster is built in GaHIN. They also get ADT alerts on the children that move. If the hospitals are sending us discrete data, we can alert DFACS that a child has been admitted to one of the hospitals. They also want dental records. I'm not sure if we have that, which means GaHIN will be advocating and looking for dentists who will come on board and help us build that DFACS record. So, but we meet with DFACS regularly, get their needs, build their use cases, and bring them back to Dr. Cheek. Dr. Cheek, we need help.
Hi.
Picture.
Hi, thank you both for your presentation. I'm Lakeisha King, one of the nurse practitioners here at Maconville Health Department. And I noticed you said that this was available through the Georgia Department of Public Health. So my question is this available for all public health departments? Is it a free thing that we can get access to? And if not, how can we access it?
Okay, so we provide access to the epidemiologists within the state agency. What we're waiting on from public health is for the public health district labs and offices to have electronic systems for us to connect to. We're still waiting on that project to get done. When that happens, we are ready to connect. But my understanding today is we're still waiting on the district offices to get connected. What we can do, we do have a solution, is bring you in on the social care side and let you get started. But I will work with the state informatics office to see what we can do. So let me make sure I get your card to see what we can do.
And one thing Dr. Hines brought up is that we're advocating on a state level from her agency and also from the pediatric mental health. As she talked about, there has to be, a two-step process in order to get mental health records, which we all know is a real big deal. But we are advocating that since the state essentially becomes the child's guardian, that the state, from the moment the child gets into a foster care, suddenly that consent is implied instantly. And so that will make it much easier to transfer information on foster care patients to providers at all levels, because the state can actually opt that child in if they would choose to do so. That may require some legal, and so we're kind of advocating at the legislative area for that as well too. Yes.
You have said this, but does this program, because it allows you to track referrals and kind of close the loop, when you use it in your, if we could get access with our EHR, does it tell you, like with different insurances, which providers are preferred, covered under different plans? I think that when we're trying to do referrals, that's always a question. It's a lot of background work to go into a specific plan and try to find who's covered and then send a referral to someone who doesn't take the insurance. So does this help with that?
It can. Today, excuse me, we do have a new project with Aetna. We just started. So what we're going to do is take the Aetna roster in the state of Georgia and help them build this for their members. We haven't yet developed the use case to put the insurance information with the services. So that will be something that will be available as a field and a workflow that we can develop, but we haven't gotten there yet. I'll take that down, put that in as one of our use cases. Okay.
Okay, thank you. We want to get